Hi, hello guys. Welcome to my YouTube channel Indian Doctor Strange. In this video, I am going to share with you why I chose pediatrics over general medicine and radiology. Okay, so this is some kind of question came to me that why you chose pediatrics over general medicine and radiology. So I decided to make this video. I am giving the disclaimer that this video is not to hurt the feelings of members of other branch, because this is purely based on my perception towards a branch and the information I gathered from my seniors. Okay, the first and the foremost reason for me to take pediatrics is it is relatively an end branch. Why I gave the word relatively means you can have the option for pursuing DM and you can also take it as a end branch. So you have a multiple options in case of pediatrics. So in case of general medicine, it is necessary to do a DM nowadays. So thinking in that way, I chose pediatrics as a relatively end branch. Okay. Number two reason for me to take pediatrics is it has multiple career options post PG. If you done PG courses in pediatrics, you can practice as a private physician, and you can do SRship in medical colleges, and you can also pursue DM in both adult and pediatrics way. Actually, once you complete the pediatrics, you can also go to the adult session by doing DM. In that there are DM cardiology, DM neuro, endocrine and respiratory medicine. Okay, so you can also go in that way, and if you are interested in doing a DM in peds, you have multiple options like neonatology. Genetics is a emerging field nowadays, and there is options for neurology, oncology, hematology, cardiology and respiratory. Okay, this is the reason, number two reason for me to take pediatrics. And as it has multiple career options, you can choose whatever you want post PG period. Okay, number three, it has a high level of satisfaction. You cannot get this amount of satisfaction in any other branch, because by treating a child, you are making the whole family happy. So you will get such a satisfaction doing peds. Okay, these are the first three reasons for me to take pediatrics. Now I am going to share with you the reason I uh, didn't choose radiology over peds, because in MD peds, as I have said, the satisfaction level is higher, and in radiology you will not get satisfaction because the patient interaction will be less in radiology. As I said, in PITS, the patient interaction is present, and by treating the child, you are making the whole family happy. So you have high satisfaction and patient interaction is present. In case of radiology, um, there is not much patient interaction, but there are patient interaction in interventional radiology level, but it has to be done at DM. So uh, it is so if you do DM in radiology, like interventional radiology, you will also get a patient interaction, but not as much as you get in PITS. So this is the reason for me to take PITS over radiology. Okay, now I am going to share with you why I chose pediatrics over general medicine. By seeing the pros of peds over general medicine, there is higher options, more options for peds after PG. So you can also enter into adult session. You can also pursue DM as a pediatrician. There are both ways are possible. In general medicine also there are more options after PG, and considering the fact that no need of DM, you cannot say that you don't need DM, but in tier 2 and tier 3 cities there is no necessary for doing DM in peds. But in general medicine, you should pursue DM nowadays. So if you are mindset of taking DM, you should choose general medicine or peds. Okay, and in general medicine, the saturation in tier 1 cities are more compared to peds. In peds also there are saturation, but not as compared with the general medicine. Okay, as I said, in PEDS you will get a high satisfaction. In general medicine also you will get, but in PEDS there's a little bit higher satisfaction you will get uh, than the general medicine people. Okay, in MD PEDS you can go into a section called research. There are more options for research session. If you are a person who is interested in doing research, you can enter in PEDS or general medicine. Okay, now I am going to share with you the cons of pediatrics. If you are taking a branch, every branch will have some cons. So in case of pediatrics, there will be less money when you compare with a DM adult person. Of course, if you do a DM in pediatrics, you will earn more. But comparing with a DM adult person, there will be less money will be given to you. And in saturation is there in some cities. Okay, PITS also there is some saturation I can accept. And in PG days, the days will be somewhat hectic. But in the point of you seeing the happy child, your hectic days will turn into a awesome days. I can assure you. So okay, now I am going to share with you some uh, best colleges to choose for MD PEDS. First, LHMC, MAMC, UCMS, VMMC. These are the best colleges. Then Grant and covering the Seth also a very good college which is in Mumbai, and Bangalore Institute, which is Institute for PEDS, and ICH Kolkata, ICH Chennai. In Kerala, there are two best colleges for PEDS. That is Trivandrum Medical College and Kozhikode Medical College. Hey guys, in this video I have explained why I chose pediatrics for general medicine and radiology. Hope you guys get a clear picture about the career options. As if you are willing to choose pediatrics as a career option, you have got a good information about PEDS. Subscribe my YouTube channel Indian Doctor Strange for more updates. And in the comment section, just text what are the videos you are expecting for me to do. Thank you and have a nice day. Take care. Bye bye.